Birmingham Hospice, we serve all of Greater Birmingham, providing palliative and end-of-life care support to adults 18 plus who are living with a life-limiting condition or a terminal illness. The Fairer Futures grant is enabling us to move further forward with a project that we started a couple of years ago that had been funded. Prior to COVID, we piloted a project where we had a clinical nurse specialist and a social worker dedicated specifically to work with the homeless organisations across the city, because we know through research and reports that there are huge barriers for the homeless accessing palliative, end-of-life care and bereavement support. But from that we learned that there was actually a huge level of support missing at sort of grassroots level. The organisations that were supporting the homeless were reporting that actually they lack confidence to have those supportive conversations with people that are dealing with grief and loss. So we are using the Fairer Futures grant to address that gap, to sort of instill and develop another layer of support for people experiencing homelessness who are going through bereavement, that they can access that support much more readily rather than having to go through all the red tape, all the barriers that currently exist for them to receive professional support. The course content is aimed at really upskilling the support workers to be really confident in having those supportive conversations. So to enable them to do that and feel confident and comfortable, they need to have an understanding of the processes of grief. So we cover a couple of theories that people who have gone through bereavement really can associate with. We look at the common symptoms of grief and loss, but also look at the complexities of people's lives who are experiencing homelessness and how that can actually manifest the symptoms even more. We'll look at how the brain functions and how that relates and reacts to stress and how that's associated with grief and loss. And again, that extra level of complexity that has with people experiencing homelessness. We look at and address the things to say and not to say to help people feel more confident in approaching their clients. And we also look at the secondary losses, so we're not just looking at the impact of that initial bereavement, but the impact of that wider network. We've delivered 3 sessions so far to a range of organisations, for example Crisis, the YMCA, a whole mix of organisations that support people experiencing homelessness. I think the outcome will be in time when we hear firsthand from people experiencing homelessness that they've been able to access that support more readily and be able to have that support and move through their grief more effectively.